you could. Is that as far as you go, or can you get that even further?
If I pulled it, I could like that.
Okay,
I can
so
get
the
further.
range is there.
The range is there. It just like
Thank
hurts
you
more
for
than
the
usual.
killer thumbnail. The head. How was that?
That would felt weird. But it was cool.
Gonna make you taller, okay? That was everything. Giselle, good to meet you today. Thanks for coming in. Giselle is a student at a nearby school here in Oakville. She's in today for a couple of complaints, so I'm just going to let her kind of talk about them. So Giselle, why don't you tell us what's going on?
Well, I'm in school for theater, which means a lot of dancing, and I love it, but it does get me really sore a lot. So I find I'm really tight in my hamstrings a lot of the time after like workouts or a dance class, and my upper and lower back both kind of get sore. Okay. So yeah,
No, that's okay. No,
it's just I get really sore really easily, and the hamstrings especially, they stay sore for a few days.
So they don't release up after a few days.
Yeah, so it'll take about 4 or 5 days for them to completely like feel okay. But I'm dancing every day, so it kind of just
you don't really get that rest period then.
Yeah.
Right? Okay. Now how often are you dancing? Like how many times a week, for example, and how long are those durations? How intense are they?
About 5 or 6 times a week.
Okay. Wow,
for about 2.5 hours.
That's quite a lot. Yeah, I can understand why you might be sore afterwards, especially if you don't kind of get that downtime, right? Now, dancing is strenuous exercise. Okay, I have several dancing patients, and it should kind of go without saying that it is probably one of the best forms of exercise you can do, both from a mobility perspective, as well as a cardiovascular perspective. But like any other kind of exercise, it is important to find ways to rest and recover between, else you're looking at increasing your risk of developing subsequent symptoms such as this stiffness or this tightness, or we hope it won't happen here, but even potential injury, right? So again, working in a gym, we face this issue very often. Like, you need to rest as serious as you perform, so to speak, right? But that being said, understand if you've got like a big assignment or something coming up, or like you got a big play or show, you need to rehearse, right? Just make sure you're doing the things you need to do to de-stress afterwards, or self-care, like seeing a chiro or seeing a massage, seeing a physio, whatever. Okay, so how long has this stiffness been going on for then?
Well, I guess I don't know. It's been kind of like a continuous thing. Like, I can't pinpoint an exact time. It's just since I started dancing when I was a younger teenager.
Okay, so kind of almost as long as you can remember.
Yeah, I just kind of coexist with it now.
And how have you been managing it? I think you mentioned that you had been seeing a chiro who used some acupuncture, and that helped you.
Yes, the acupuncture helped. I didn't stick with that for too long. I use like rolling kind of like tools to roll things out. Okay. And I do a lot of yoga, which that kind of stretching really helps as well. Usually I'll just power through it. It's not like insanely painful, but it does get noticeable because it's a lot of up and down too, especially with my back. So for managing it, if it's really painful, I'll take like an Advil. But usually I'll try to just like roll it out or stretch it
yourself. Okay, yeah. So stretching, mobility, yoga. If dancing is a good form of exercise for you, yoga is probably the best form of exercise, and that's from somebody who hates doing yoga. Okay, like I really do think it's yoga, resistance training, and then dancing. I think that could be like the best order of operations. Maybe swimming is tied with dancing there, but I'm also biased. Regardless, you're doing the right stuff for self-management, given kind of your routine. Now, if I can ask, why didn't you stick with the, because you mentioned off camera that the acupuncture really did help you, why didn't you stick with that as like an adjunct to this?
Well, it was more so for a specific injury that I got while dancing.
See? Injury. Okay.
Yes. Yeah. In my hip flexor.
Okay. Do you know what the injury was? Did you get a diagnosis?
No, I didn't get a diagnosis. I just kind of went in with a lot of pain. Yeah. And they adjusted me a little bit, and they did the acupuncture. The acupuncture, I don't know how it works, but
it's complicated.
There was the pressure, the release of pressure was really healing. So I don't think anything with my hip flexor was too serious.
Good.
But after that, was like kind of healed and wasn't bothering me anymore, I didn't
kind of
really
get from there, right?
Yeah.
Okay. All right. So yeah, hamstring tightness, low back tightness. This is actually the second time that we're trying to film Giselle. We had an appointment about a week ago, but unfortunately she messaged us saying that she couldn't really get out of bed because she had a really bad migraine. Mm-hmm. So it's ironic because Kyra can help with migraines, but totally understandable. If you can't drive, you're not driving. It's just like that. And home visits are insurance nightmares, so we're not doing that. But migraines, how long have you been dealing with those for?
About once a month since I was about 15.
Really? So you've been having them for a very long time. Did anything, like 15 is kind of around that age where puberty does onset, but aside from that, did anything else kind of change to start these headaches, or?
Not that I can think of.
Okay.
I'm pretty sure it's like it might be a genetic thing because my mom deals with them much worse and much more frequently than me.
Mm-hmm. You said you get them about once a month? Or?
Yeah,
okay.
She'll get them like 2 or 3 times a month.
Okay, all right. Have you noticed any kind of recurring triggers to that, whether or not it's like pressure outside or foods or anything like that?
I definitely think weather is a big influence. I don't really know how to determine the pressure outside, but like if it's raining, if it's cloudy, that definitely does make it worse. And even if it's not a migraine, like my head will hurt a little bit if it's raining.
Yeah, totally possible. Weather is a huge trigger for people like this. Usually, for people who suffer from migraines, usually I would recommend individuals such as Giselle to keep something known as a migraine or a headache diary. I believe you said your mom keeps one of those. Yeah. And that's just like whenever you get a migraine, you get a headache that comes on, the best form of medicine for those things is prevention. So if you are able, as soon as you get that migraine, you grab your journal, you write down everything that's happened to you in the last 24, 48, 72 hours, whatever. Usually the first 24 to 48 is the most important. And then you look for reoccurring themes between your occurrences, okay? And that usually comes down to diets, kind of hormonal fluctuations if you are a woman, or pressure changes in the environment, right? One of those 3 things, if we can figure out if it is related to hormones or related to diet, we can modify those things. Pressure, unfortunately, you might need to move to a different country, but we can't quite afford that one if you live in Canada, so that's the way that goes. All right, so anything else that you want to talk about before we kind of get into treatment for today, or?
I think I'm all good.
Oh, awesome. Okay, so what we're going to do is we're going to do a physical exam to take a look at that upper back and the lower back as well as the hamstrings, and then we're going to find a method of treatment that's going to work for you, okay?
Cool, thank you.
So nice and easy, I'm going to get you started by bringing your chin down to your chest for me. Does that provoke any of the kind of upper back stiffness that you were talking about before?
A little bit.
Where?
Like around here.
Kind of right at the base of the neck, upper thoracic
yes.
area. So she's pointing to about T2, T3 region. You should come back up. You can look up towards the ceiling for me, please. Does that provoke anything back here?
Not really.
No, that's okay. Extension's fine. I'll get you to rotate your head as far as you can to the right, please. We can get to a full 90 degrees. Nice. As far as you can to the left, please. We're a little decreased on the left rotation. We can only get to about 80 or 75. Not by much, but it is noticeable. I'll get you to bring your right ear down to your right shoulder, please. We can get to about 50 degrees, left ear to left shoulder. We can get, again, we're a little bit reduced compared to the other, but it's not by much. We're at maybe 45 or 40 on this side. So we do have a little bit of decreased range of motion on the left ranges of motion for her neck. Whether or not that's a concern, I'm not really sure yet. We need to actually feel through the upper back to see if there's a associated stiffness with that. Do you ever feel like you're more tight on the left than the right? Or,
oh yeah.
Yeah. Are you left-handed?
I'm right-handed.
You're right-handed. Okay, but you do for whatever reason feel more stiff on your left. Okay. I'll get you to give yourself a tight hug. You probably earned it. Tight hug. Good. And then I'll get you to rotate as far as you can to the left for me. Okay. We are able to get to about, I'd call that 55-60. Now as far as you can to the right, please. I'd call that 55-60. So the thoracic rotation itself is fine. When you can relax there. When you're mentioning your upper back tightness, are you actually referring to like up here primarily, or more this region?
It's like, it feels like it's on my spine. Like my shoulders aren't really sore.
Okay. But it feels like kind of center almost in through there.
Yeah.
Okay. All right. You have a little bit around your shoulders, not much. I'll get you to stand up for me, please. All right. And now, if you could, please try to bend down, touch your toes, okay? Any discomfort in the low back with that? Thank you for avoiding the microphone. But that. Any discomfort with that? No, she can reach the floor. Good. Come back up for me. And I'm going to get you to bend back the other way, okay? Like so. Yep. And that's okay as well, eh? Perfect. All right. Giselle was mentioning that she's got quite a bit of hamstring tightness as well as low back kind of tightness, stiffness, soreness. Those two things can often go hand in hand with each other and present simultaneously, but for multiple different reasons. We could look at potentially lower cross syndrome with that anterior pelvic tilt, meaning we have lengthening of the hamstrings, which is then perceived as tightness because it is taut. Or we could have posterior pelvic tilt, which would be contraction, true actual tightness of those hamstrings, then causing further back stiffness as well. So let's just kind of see what her straight leg raise range of motion is to kind of determine if we do have a hamstring involvement here. So what I'm going to do is, do you feel more tightness on one side versus the other? Are you pretty symmetrical?
I'm pretty symmetrical.
Pretty symmetrical? Okay. So let's start with this left side. I'm going to bring this straight up as far as it will go. Okay, and she says she has tight hamstrings. This is, I don't know, I didn't do too well in geometry, but this is probably somewhere like 140 degrees, 150. That is the farthest straight leg raise that I have seen with multiple different dancers here. Now, when somebody comes in and says, Adam, I got tight hamstrings, I'm usually expecting to hear. Okay, we get about a 30 degree before they start to feel pain in the back of the leg. Any pain in the back of the knee as we brought you up to 150?
Not
No?
really.
Okay.
The thing is usually I can get it like to my head,
Really?
but that was really tight. So that's like,
So tightness by your standards.
yeah.
Got it.
Sure.
Okay. All right. Now let's go ahead, bring this all the way up. Same deal. And you could, is that as far as you go, or can you get that even further?
If I pulled it, I could, like, if I went like that, I
Okay,
can
so
get
the
further.
range is there.
The range is there. It just like
Thank
hurts
you
more
for
than
the
usual.
killer thumbnail.
Yay!
All right, there we go. Okay, wow, sorry, that just really caught me off guard. Okay, we're gonna go ahead and do some SI testing now. I'm gonna bend this, my hand's gonna go behind your back. Any discomfort as I push through there? No? All right, we're gonna take this, gonna bend, hand behind back. Any discomfort as we push through there? No? Good. Might as well do a hip range of motion screening too. We're gonna bend, bring this all the way up. I assume that's totally fine. Yep. That's okay. That's okay. Good. And same deal on this side. Bring this up. Rotate. All good.
Yeah,
Oh.
that one's a little bit more.
What do you feel
uncomfortable.
when I do that?
Like kind of a pinching kind
Where?
of feeling.
Where?
Do it again.
Gladly.
Like kind of here.
We're looking in kind of the quadriceps area, or
Yeah.
more of like the groin proper?
I think quadriceps.
Quadriceps. Okay. Is this the side that you mentioned you had that injury on that you got handled through acupuncture, or no? Was that?
No, I think
that
this
was over
side.
here. Okay.
Yeah.
So more quadriceps right in kind of, that's where you feel the most pinching. And to confirm, bring this up, rotate. That's where you're feeling it?
Yeah.
Okay. Let's go the other way. Anything there? Oh,
Oh.
wow. I'm glad the mic was right there. It actually would have picked that up. So that was your hip. That
Okay.
just went there. You know what? Let's do something kind of fun here. Bring this up, test. Do you get that pinching still?
Not as much. Whoa, that was cool.
All right, so we actually do have, by definition, tight hips here, even though, you know, she can get her legs all the way up. But hey, it seemed like a pretty simple fix there. A simple improvement. There's more to be done. All right, Giselle, my hands are going to go on your back now, okay?
Okay.
All right, so. How do you feel left versus right in terms of tone, or tightness, rather?
I guess the left feels a little bit more sensitive.
Yeah. So up here, we definitely got more left-sided stuff going on. As we determined through the neck range of motion, she did comment that it is for the left side that feels tighter. That's also true down in the lumbar spine as well, just by my touch as well as her kind of report. So it's interesting to see that we kind of are getting left-sided, we'll call it symptomology or tightness, throughout all back regions. We can absolutely handle it today, no problem. Just conveniently all on one side versus the other. That kind of feels like a guitar string, huh?
Yeah.
I'm not musical, but any requests? No?
Wow.
I always follow that joke up with Wonderwall. You're my Wonderwall. I shouldn't sing in front of two theater people.
I was gonna say, you probably are like a theater people, so.
I used to be in choir, then I hit puberty.
Oh, that happened to my brother. They started to make him lip sync in
It's
choir.
terrible, right? Yeah.
So sad.
Yeah, it's true. Okay. So. All right. So, Giselle, what we're going to do is we're going to attempt to adjust kind of through your upper back now with a bit of a bias towards that left side, but we are going center. So what does that mean? Now, you've seen a chiropractor before, you've been adjusted before, but the first time that a practitioner adjusts someone, you never really know how much force they need. All right, I have 300-pound men in here that I could basically sneeze on and they would release. I have under 100-pound girls in here who I all have to but body slam in order to get anything to move. I am not going to be body slamming you today. Okay. I'm also not going to be sneezing on you. Both are kind of disgusting. But what I will do is I will start lighter and I will build up gradually with more force if needed. Okay. So what I need from you, actually I'm just going to take this microphone and move a little bit closer because this is why people watch chiro videos, is to take a big breath in for me and then all the way out and sink into the table. Good stuff.
Whoa.
And just breathe normally. Okay, that's okay?
Yeah.
All right. So I'm going to get you to take another breath in for me, please. And then all the way out. Relax. Good stuff up there. You okay? Good stuff. One more breath in. All the way out. That was a good one? Yeah, okay. So that upper region, that was around maybe T2 to T4, is where she was reporting the most stiffness on that forward neck flexion. So happy we were able to get it because that was kind of her primary area on that side. Let me check over here. There might be a little something here. Breath in, all the way out. Yeah, there was a very, very subtle one hidden in there too. Grab your arm here. We're going to pull, nice, and we're going to put you just like so. We're going to bring this leg up, bottom leg straight for me, please. Nice. And scooch the hip towards me. Awesome. We're in position here. So what I'm going to get you to do is take a big breath in for me, and then all the way out. All right, all the way out. Good. And sink into the table.
Ooh.
That was everything. There, we got the lumbars and we got the S side.
Damn.
We're gonna take this, I'm gonna pull, and bend the elbow right there, good. All right, breath in, and then all the way out like fast. And sink to the table, good. There we go, 1, 2.
Ooh.
Feel okay?
Yeah.
Love it. All right, and just relax for me. So what we're gonna do first is just kind of feel through the neck and do some basic kind of massage work. So if at any point in time you find that this kind of triggers your complaint or you start to get a migraine, you let me know. You should not, but sometimes we do get them in relation to neck tightness, okay? Now once again, Giselle was having trouble with, not really trouble, but a decrease in left-sided ranges of motion within her neck. So I'm gonna start by looking kind of in the lower aspects of the C-spine. How do you feel down there right now?
That feels pretty tender.
It feels tender. Now let's compare this to the right side. How does that feel on the right side? Nowhere near as bad, eh? Let's get the hair out of that eye, okay. So yeah, that would be a combination of the range of motion findings as well as the patient's self-report of tenderness in the area is an indication to adjust. Yeah, so that's what we're going to do today. Okay. So what I need from you is to turn your head as far as you can to the right. Drop, drop, drop. Good. Now see, you'll notice as she relaxes, the SCM shuts completely off, the sternocleidomastoid muscle. That's how you can be indicated that she isn't engaging muscle. And it's important that we don't engage muscle as we do this, because that's going to make my job harder. So once again, drop the head. How was that?
That one felt weird. But it was cool.
Really glad you think it was cool. That's important.
Yeah, I use the word cool, not weird.
No, I'll take weird. People call me weird all the time. I'm used to it. Yeah. All right. And so that was what we call a rotary adjustment, where I am, well, almost rotating the neck would be the best way to do it. From the other side, we're going to take a contact for something known as a lateral adjustment, where the movement kind of pushes directly through the neck to further gap that left side. So yes, I am adjusting the other side, but the technique is in line with what we're dealing with. So once again, drop that head. Boom, good. SCM turns off. And there we go. Gonna make you taller, okay?
Cool.
Alright, good stuff. Alright, so what we're gonna do here, these overalls actually used to have buttons on them but then broke. So she tied them. We can work around them. Fortunately, they're quite loose. Now, we will be doing the instrument-assisted soft tissue therapy today, obviously, because she was commenting that she does get stiffness within her lower back as well as her upper back. However, she is an actress. That means that she has an event coming up where her shoulders will be on display. Now, you don't want your shoulders on display all marked up in red, which we know can happen when we're doing this technique if you watched any of my other videos. So we're only going to be limiting this to the low back today. Should she come back, absolutely we would be incorporating this into the treatment plan. So at this point in time, Giselle, I usually like to ask my patients a question so that they can kind of talk about themselves and brag a little bit about whatever they want to. And that question is to please tell me, as well as the audience, something about yourself that you're proud of but don't usually get to talk about because it kind of comes off as bragging.
Well, I can talk about the event I have coming up. It's an every weekend thing. I work as like a party princess for kids' parties and events and things. So tonight I'm gonna be Elsa, and it seems like kind of a silly job, like working for kids, dressing up like a princess. What drew me into it was getting to perform and work with kids at the same time, because those are two things that I'm so passionate about. And the more I've done the job and the more confident I've gotten in like doing the songs and working with the kids, I've grown such an appreciation and respect for what the job entails. I actually feel like a huge responsibility to these kids, because to portray like this role model for them. And I also think there's something to the character of Elsa that, I don't know, in the context of Frozen, Anna's a very much stereotypical classic princess, but Elsa is the one that all the kids are drawn to, who's a little bit more introverted, who like craves independence and freedom, and it has a bit of more of a feminist storyline. So I really appreciate how the kids perceive Elsa, and I do feel like a responsibility to be a good role model to kids. And so yeah, I'm really grateful for that job, and just the fact that I get to sing and dance and perform during it is such an added bonus.
You know, what I really like about what you just shared there was that, like you said, it does kind of seem a little bit almost silly or childish, like you're dressed like a princess, but no, you really do see the value in what you're offering to those kids, because like you mentioned, role models, especially as a child, incredibly important, and can outright shape who you become as a person. So that is a lot of responsibility in the name of, or excuse me, not in the name of, in the words of one of my role models, with great power comes great responsibility in that sense, right? So exactly, well, originally it was his uncle, but yes, then Spider-Man says it a bunch. So yeah, no, it's good that you see the value in that, and that you understand that what you do can literally have an impact on that kid growing up or going forward in that sense. So, you know, hats off to you for that.
Thank you.
Of course. So yeah, we are seeing some of that redness that we're talking about kind of here in this region. We do have a TKA formation. Again, she's going to be Elsa today. We don't want that occurring up here, hence why we're not doing it up there. what we're going to do here, Giselle, is because we do have tightness in the upper traps as well as the levator scap, which is a little muscle here that I'll show you on my app afterwards, but we don't want to scrape them because we don't want to show that redness. It's important that we do some muscle work in there today, all right? Specifically something known as myofascial release technique, or MRT. What's going to happen is I'm going to get you, we'll start with the, we'll actually start with the left side because you have more tension on this side. So I will get you to look up and to the left for me. To the left, good. And I will take my elbow, put it right here, and against my pin, I want you to look down and to the right. Okay, slowly, go ahead. Good, and then we're gonna move a little further. Is that okay? Mm-hmm. All right, I can't tell if there's a painful expression on her face or not, but you should look up and to the left, and it's now down and to the right, and we're gonna do that movement over and over again, let's say 8 times, okay? So that's 2, up to left, down to right, up to left, down to right. Ooh. There's a click, yeah, up to left, down to right, up to left, down to right, 2 more. Okay, there we go. And up to left, down to right. Good. All right, now that's for the levator scap. We're going to do a different motion for the upper traps. We're going to get you to tilt your head like so. Good. I'm going to take that elbow once again, put it right there, and now we're going to tilt the right ear to the right shoulder. Go ahead. Good. A little slower than that, okay? Come back to the left, slowly to the right. Good. Left, slowly to right. Left, slowly to right. Ooh. How does that feel in there?
Yeah.
Just a lot, yeah? 4, 2 more. Left to the right. And then left and to the right. You know, you should have actually come in the Elsa costume. I think if I...
That would have gotten you views.
If that's just it. If I make a title like Elsa Goes to the Chiropractor, holy, I'm viral. It's that simple, right?
The lag to the head wasn't enough for you?
Let's shoot another session in a month. Okay. You can come in costume. Okay. Boom. All right.
I got you.
That'll be the one video I can check is made for kids. That's the only one I'll be able to check like that. But then it demonetizes me. Oh, great. Okay, anyways. You should look up and to the right, please. Other right. Perfect. All right. Now you just slowly look down and to the left now, okay? Up and to the right. Down and to left. Up and to right. Down to left. I feel like I'd probably make some children cry though when I quote unquote like snap Elsa's neck. Yeah. That would be pretty bad. Eh? So maybe not. Yeah, okay. Down to the left. Down to right. Down to left. I'm really bad at counting. Was that 5 or 6?
I wasn't counting.
Okay, 1 more. Right, and down to left. Good. All right, face forward. Tilt right ear to right shoulder. Crush it, and now left ear to left shoulder. Go ahead. Good.
Oh my gosh.
Tight.
Yeah.
And left to left. Good. Right to right. Left to left. This is 3, I think. 3 more. Right to right. Left to left. 2 more. Left to left. And last one, okay? Right to right. You're tough, you're strong. 1 more. And there we go. Good stuff.
Man, those ones hurt.
Those are a little tender.
Yeah.
Right? Yeah, okay. Shrug the shoulders up for me and slowly lower. This is the trap shake that I mentioned that you'd be familiar with. Up. Slowly lower. She's not coming back, is she? Up. Slowly lower. Giselle,
yeah.
How did you find all of that?
It was very interesting. I mean, it's not my first experience with a chiropractor, but it's been a few years. So I guess I was anticipating the cracks to be to be more painful.
Yeah.
But it did feel like a release.
Good.
Especially in the neck. The neck was what I was most nervous for. And that was way chillier than I expected.
That was chillier. That was chillier. We like that a lot.
Yeah. Yeah, the fascia massage, it was completely new to me. So that was really interesting. I'm used to doing fascia releases for dance class.
Of course.
So I guess I would have a question about
of course.
Fascia releases. Would jiggling be a good everyday practice, or are there more kind of ways to release the fascia that I can
Yeah, so we did kind of talk about how. I talked about the trot shake with you, right? So I do include a little bit of actual shaking or jiggling as you're describing, as well as I believe your dance instructors have mentioned that's a method to try to loosen up the fascia, and it's true. Okay, that is a method to try to temper some of the fascial complaints that you're dealing with. In my experience, I'm not a professional dancer, okay, so I don't know what does and what does not work for them. But in my admittedly extensive experience in working with fascia as one of my primary interventions, I found that nothing really beats either the tools or cupping. Cupping is a close second.
Okay.
The reason that I prefer the tools to cupping is that when you cup, you're limited to the surface area that you put the cup on. Some of them can move it around. I just prefer the tools because you can really target anywhere you want to on the body, right? Now, once again, fascia, superficial structure, the tools and the cupping work well on it because it works on the superficial layer. Deep tissue massage, you're actually going through that, you're working more the muscle. So on your end, jiggling or vibrating could potentially be one of the better things you can do for fascial release. One thing I would recommend to you genuinely is to come back in this case. And the reason for that is because with the tools, I've had a lot of success in releasing fascia clearly. So again, we didn't work your upper back because you got to go be Elsa later, but I would absolutely want to work your upper back, and we'd probably find a pretty moderate to almost severe amount of petechiae formation. That's the red splotchiness, which indicates release of present or formerly present fascial adhesions. So the treatment plan kind of looks like we do that, we wait till it heals itself up, clears, we do it again, and there's less petechiae. And we just keep going until ultimately you don't get any forming. That means your fascia has finally cleared up. How long will that take? It depends. You're young, you're healthy, so I would wager probably pretty quickly. But keep doing what your dance instructor is telling you to do. I feel like that's only going to benefit you. There are also other things we can do to help improve your recovery. I do think that this stiffness is more related to fascia because you are still quite mobile. It's not like you're getting muscle restrictions due to this. Again, you get the hamstring behind your head practically, right? So I think that this would primarily be a fascial chain complaint, especially if it's all throughout the entirety of the left side versus just one specific area. Does that answer your question?
Totally,
okay.
Thank you.
Any other questions at all?
I think I'm all good.
Good.
Thank you so much.
Happy to hear. Well, one other thing, getting adjusted, especially in the neck, can be kind of alarming or scary to people. Very, very safe procedure. You got to do a full exam. You got to do a full history. You got to have a good sense for whether or not this is going to be properly responded to. So don't be worried about it. Ignore Hollywood with the Black Widow or the whoever kind of jumping up on people. Very normal thing that we do here. Okay. I asked you any other questions, but otherwise. Thanks for coming in today, Giselle.
Thank you so
really
much for
very
having
much appreciated.
me. Of course, thank you. Don't forget to like, comment, and subscribe.
Thank you, Giselle.